Today we're getting under the hood of women's health with Rachell, a maternal health advocate, entrepreneur, and founder of A Light After 9, a nonprofit dedicated to supporting families navigating pregnancy loss, infertility, and maternal trauma. Rachell will get under the hood of high-risk pregnancy.
So I had 9 pregnancy losses, and I couldn't have fathomed that would be my pregnancy journey at all. So it was filled with a lot of complications. I had issues with finding healthcare, and I'm in a big city in Atlanta, which was just insane because we have a lot of hospitals. But during one particular pregnancy, I had to fly to Dallas after a failed surgery to try and save a 20-week pregnancy. So a lot of trauma, a lot of maternal health disparities, a lot of mental health issues stemming from this process. So in 2018, I had my first pregnancy. I had an at-home pregnancy test that was positive, but I went to the OBGYN immediately because I had bleeding. He told me that I was having a miscarriage, but he also reassured me that my pregnancy journey would be fine and that this is all a part of the pregnancy journey, that a lot of women have miscarriages and they go on to have a healthy pregnancy. But in 2020, when I became pregnant with twins, I was sick. I was bleeding again. I was concerned. I thought about what he had said, but something just didn't feel right. And my symptoms worsened. I had severe abdominal pain. I was in and out of the OBGYN's office 2 or 3 times a week. And at 13 weeks, I lost the first twin. All of my symptoms resolved after 13 weeks. And I felt comfortable enough to allow my friends to throw me a gender reveal to celebrate my pregnancy. But on the date of my gender reveal, all my friends were there, and I went to the bathroom to use the bathroom, and the baby just fell out. And when I went to my OBGYN's office a few days later after going to the ER, she diagnosed me with cervical insufficiency and told me that from now on, I would be considered high risk. Despite of bleeding the first miscarriage and being told by the OBGYN that everything would be fine, during the second miscarriage, I still had bleeding. That bleeding was not normal. And I had twins at the time. I also had a lot of pain, severe pain, that kept me in and out of the hospital and the OBGYN's office. So with that pain, they were monitoring both of the babies to make sure they were fine, which I was told they were. But I also, after losing the first twin at 13 weeks, I woke up wet. I came to find out after I lost that baby that was amniotic fluid. So my water had broke, and essentially I was giving birth. I don't feel like I managed it very well in the beginning, and I didn't seek therapy until after my 6th loss. But I wish I had sought it earlier in the journey because it was a lot. It was a lot to deal with mentally. It took a toll on my relationships. It was just a lot to digest. And I sought talk therapy first. And then I went and found a hypnotherapist under the recommendation of my talk therapist. And those 2 types of therapies combined really helped me along my journey. The entire pregnancy journey was an unexpected complication, to be honest. I thought that I would get pregnant, have a few OBGYN visits, go to the doctor, go to the hospital, and then deliver my baby and take my baby home 2 or 3 days later. That's what, in my mind, that I thought I was young, I was healthy. There was nothing, outwardly wrong with me to make me suggest otherwise. So definitely the first miscarriage was unexpected, but because of the confident reassurance of the doctor, I believed that I would go on to have a healthy journey. So I felt that reassurance and that hope. And then with the second pregnancy with the twins, after losing the first twin, I was still hopeful because I was still pregnant. So I thought I would be able to see and care for that baby because all of my symptoms went away. So I thought. And then I got a diagnosis after that, those losses. So I was like, okay, well, I'm diagnosed with cervical insufficiency. So now we have a diagnosis and we have a definitive treatment plan. So it kept pushing me forward. because I kept getting reassurance from doctors, and they kept telling me, well, we haven't tried this. So I was like, okay, well, unless we have exhausted all options, as far as I'm concerned, I can keep going. So once I reached pregnancy number 6 and I was able to get the cerclage, like she said, I was hopeful again. But when it failed at 20 weeks, I lost hope. But then I regained hope because I found a doctor who put in another cerclage during a 20-week pregnancy for twins. I only had one baby. So then I had hope again. So it was those little rays of hope that just kept me pushing along that journey. Medically, there were certain doctors that were super supportive, went beyond the call of duty. I had one nurse practitioner friend who checked on me 2 or 3 times a day. She would call my doctors and advocate on my behalf. Her name is Sally. And when I had nothing left to give and nothing left in my cup to pour, Sally would take over. Even if my cup was full, Sally would still take over. But people like that who really cared about my journey, who were right by my side throughout this fight of a pregnancy journey, such as my family and my friends, who sometimes were confused regarding how to take care of me or how to talk to me or how to approach me. All of those things and all of those people, including my therapist, just really were the people that I leaned on throughout this 9-pregnancy stint. Biggest lessons that I learned was taking a break. I didn't do that throughout my pregnancy journey, and it really, really weighed on me after. Once I was able to rest, which is after I had my baby. There's no such thing as rest with a newborn baby. So it was not a legitimate rest, but that's when I was able to just grab some time to mentally rest and to even just think about what just happened to me the past 4 years. I was in a state of trauma for 4 years, and there were times I didn't even know, and times I definitely knew it, and times I didn't cope with it. But after that time, I was able to just think about what I had going on and try to address how I was feeling and what I need to do to be the best mom that I could. Like I said, when I went into motherhood, I thought, for whatever insane reason, I thought I would get pregnant and just have a baby. But now I look at mothers very differently. Whether you had a cookie cutter pregnancy or you had a loss or multiple losses, it's all very difficult. Your body changes so much and you don't really understand what's going on until you go through it. And I didn't know until I went through it. So I look at moms now, even more so of superheroes, even more so of just extraordinary human beings, because we give so much when we don't have it. I had 9 pregnancy losses, and I'm a healthcare provider. So I can only imagine what others who have no healthcare experience goes through in a pregnancy, especially a complicated one, and especially recurrent pregnancy loss. It is so important for you to listen to your body, monitor that bleeding, that leakage that you're feeling, if you're having abdominal cramping, if your intuition is telling you that something is wrong, do not ignore those signs. You can be just like me, listening to doctors or trying to gaslight my own self to think that nothing is wrong, and then it ends up in a miscarriage or a stillbirth. And then I'm just left with regret and wishing I had advocated for myself. So listen to your symptoms, advocate for yourself. And if you don't know the symptoms, ask your doctor, ask a trusted professional. Do the research. You need this in order to advocate for yourself, in order to speak up on your behalf, in order to make sure you are heard. And if you have a healthcare provider who is not listening to you, who is gaslighting you, who is dismissing you, and you know you're having these symptoms, go to another healthcare provider. But whatever you do, do not allow anyone to tell you that you're not feeling what you're feeling. What you feel is valid, what you're going through is valid, and it should be addressed. These 9 losses left me in a place of despair and uncertainty, and left me with so many negative emotions. And I wish I had sought mental health resources earlier. I wish I had the strength and the access to them earlier. But before you start your journey, if you can, and definitely doing, reach out to mental health professionals to help you make it through this journey. Because sometimes we're in survival mode. We're not in thrive mode. We're in survival mode because we're just trying to make it to, we're just trying to make it through. But use your resources, advocate for yourself, listen to your symptoms, trust your instincts, and fight for yourself in your pregnancy.